extensively over the United States and throughout the United States. The day that they came to Shelby County, they were ill and sought medical attention at that time. That medical provider followed all of the current protocols for testing, and that's why they were able to get the test done. It was done in a private laboratory, and we received a report of that today and are working with the individual to get more information about where they were staying, where they visited, what activities they engaged in while they were here. They were instructed on the day that they sought medical attention to remain isolated, but we do try to confirm whether or not the individual followed instructions.
Can you say how long ago it was that the case came to your attention?
Well, it came to our attention today because that's the date that we received the report from the lab, but the specimen was processed and turned around in less than 3 days. So it's been a matter of days. Yes, sir.
Any idea on when, from CDC, away from the private labs, when we might get a bulk of testing for Shelby County? Any idea of numbers and when? Mayor Strickland mentioned a week or so yesterday. Do you have any clearer idea?
So I can't give exact numbers because I would be giving misinformation. What I can say is that we know AEL is able to run specimens. We understand that LabCorp is also able to run specimens. And then both the county and the city are working with the University of Tennessee to be able to implement expedited testing locally. And our goal is to have a pilot site by the end of this week to see how that goes, how the workflow is, and be able to expand from there. So I think what we can say is that every day we're working towards having more tests, and that there's a variety of ways that people will be able to get tested in the future, but I can't give you exact numbers at the current time.
What would happen at the pilot site, and would that be the UT test?
UT would actually be the main coordinator of that, but it's in partnership again with the county and the city. So we're working together as a work group to look at shared staffing, locations, how quickly we can process, and how quickly their labs can process specimens. They have a goal of how many they want to be able to test per week, but I'm not able to release that because I think they're still working on their numbers currently. But I can say the community is very responsive, and I probably haven't said that enough, is I really want to thank everyone. I think, from elected officials to the average person. I am in the grocery store and people will walk up and say, this is what I'm doing to reduce the spread of COVID. So we really rely on our partners to make a difference here, and that includes our academic partners like UT and the University of Memphis.
The state has just tweeted out.
Would those tests be free?
There will be some variability. Obviously, if someone's insured, they go through a private lab, there might be billing to that insurer.
In terms of the UT test?
I'm not going to speak to UT specifically because I don't know what their process is going to be for potentially billing and providing services free. What I can say is we are all sensitive to the number of uninsured in our community and looking at ways that we assure people who don't have insurance and may not have financial resources are able to access testing as well.
The state just tweeted out only 2 in Shelby County. Have y'all reported it yet?
The third?
Yeah.
Yeah, the third should be put on their list soon.
Okay.
Yeah.
Because they just tweeted at 8.
Attending, are you able to tell us how many are contacts of cases 1 and 2 versus unrelated to those?
What I would say the majority that we have pending are related to case number 1 and 2 because they're related, but primarily to number 2.
I want to ask about, it seems like at least here in Shelby County, and I'm no public health expert, but Nashville, Davidson County, they're seeing a lot of cases there. It seems like that they could have more of a community spread situation. At this time, it seems like y'all do not believe that we have that going on in Shelby County. Is that where you are with this, and at what point does it transition to that?
It's a great question, and yes, currently the evidence doesn't indicate that we have community transmission, but as I noted about the third case that we were informed of today, we know that person didn't contract it here, but we also don't know now where all that person has been. And so that might change the equation as we continue that contact investigation. Additionally, as soon as we have cases that we can't link to the first or second case, then we will say we're moving more towards community transmission. The things that are really important, and that's a strength of Shelby County, is early case finding, so that when individuals present to the emergency room or their healthcare provider with symptoms, they've been tested, and it allows us to identify those individuals really quickly and then isolate them and quarantine their contacts.
And then as this quarantine carries on and people are forced to stay at home and they realize
that these cases aren't originating in Shelby County, do you have concerns that people will kind of give up and will want to resume their daily lives kind of prematurely?
We're relying heavily on the media to get the message out that we want to contain the spread of COVID in our community, and that really means that everyone's going to have to pitch in, and that means staying at home, avoiding contact with more than 10 people at a time. We've all heard that from the president, and that's been reinforced through the CDC. And to avoid, like even going to the grocery store, trying to go when there's less people in the store. And this is particularly important for our seniors who are the most vulnerable.
Just
Because
because
we
we
have
have
a
clear
lot of
now
folks-
doesn't mean it will be that way forever.
No, it won't be that way forever.
So we have a lot of folks that have been asking about appointments. They've got things like hair, nails, where they've also have things like doctor's appointments and dentist appointments. What advice can you give?
Everyone has to use judgment based on the location, but you will also see that many businesses are altering their practices. So I mentioned to someone the other day, I went in the grocery store and next to that was a hair salon, and they had a big sign out that they were limiting the number of customers in the facility and that they would not allow employees to work who were ill, and that might cause some inconvenience, but their focus was on assuring the health of the public. And so I think that's the most critical thing, is that each business at the current time needs to look at their workflow and determine how can they reduce contact between individuals. And I think as citizens, we need to look at what we're doing and what we might alter. So maybe we don't get our nails done this week. We wait till another week or put it off till in the future.
Do you think that bars and restaurants should be closed as they were in Nashville?
So at the current time, the data that we have locally doesn't indicate that that's necessary, but I'm going to reinforce what has been said by both, again, the president as well as the CDC, is people should not congregate in areas where there's more than 10 people. And so that would mean limiting going into restaurants and limiting going into bars. There may be a point in the near future where there is a recommendation to close if we have community transmission, or if the governor decides that the measures need to be spread throughout the state. And then some restaurants are choosing already to do delivery and to do drive-through, but not necessarily having people sitting in the restaurant.
How much have you all been monitoring? You know, I know someone that had contact with a person who tested positive in another state. That person is here now, and they were told that they couldn't be tested or monitored because they weren't showing symptoms. You know, I know that a lot of folks, as this has grown, you know, they realized they did have contact with somebody, or they were in the same room as somebody. How much monitoring is being done here locally for cases that are not here in Shelby County?
So typically the way it works in public health, if there's a case of any illness diagnosed in another state, and there's a need for contact tracing, contact monitoring, or quarantine in like Shelby County, there's notice that's sent between the two states, and then that information is sent to us. And we would treat those individuals just as if the case were here in Shelby County. What we need to keep in mind is that many people who are contacts are asked to self-monitor. So they're supposed to remain in their home, not have people coming in and out and checking their temperature as well as signs and symptoms every day. They would not be offered a test unless they became symptomatic. And that's based on the CDC protocol, and how often we self-monitor, or whether it's daily or an interval basis, depends on what their risk is at the time. So I can say here in Shelby County, we're following the CDC guidelines, and even if they're a contact to a case in another state, if we have notice, we're going to treat them accordingly.
As more tests hopefully come online later this week, more options, would you recommend everyone who's able to get a test even if they don't feel the symptoms, or do you think there should be kind of a priority for those who might have potential symptoms?
And the word I would use is triage, not priority. Is that with any illness that any of us may have, our healthcare provider is going to take a history and a physical and then make a determination on what tests need to be done, and that's what would need to happen. Mass testing for people who don't have any risk at all really is not warranted at the current time. It is that history and physical that determines whether someone should receive a test or not receive a test.
And there are some reports coming out of concerns about enough stockpile of medical equipment, worst case scenario. Have you been speaking with hospital systems? Are you confident in Shelby County, worst case scenario, they need tents and things like that there's enough to handle the demand in Shelby
So
County?
there's a system in place that falls through emergency preparedness, some through public health, but also through the Office of Emergency Preparedness and Homeland Security, to assess daily, like number of beds that are available or not available. That's through what's called the Hertz system, as well as whether or not we have sufficient PPE or not. But I think it's known nationally that if we achieve worst case scenario, we do not have sufficient personal protective equipment for particularly healthcare providers and frontline responders. And so we have to recognize that, and ideally the federal government will get moving on having more things manufactured. At the current time, we do not have a shortage today within healthcare systems, and there is a mechanism in place to monitor that, and that system is actually statewide and nationwide.
With reason to contain.
Yes.
Dr.
So I,
Walshalter, wonder if people are being turned away for the tests. They feel it's because there are not enough tests. Could you speak to that? Are there enough tests?
so there's enough tests for people who meet the criteria for testing. And we get calls throughout the day that people just want tested, but they have no risk factors for testing. Those people would not be recommended for testing. And then there may be people that present to their healthcare provider that have flu-like symptoms. The recommendation is to test for flu first, and then do a viral panel, then the COVID test, if you've ruled out everything else, if the person's not at risk. And I do want to remind people, this is flu season. We have a significant amount of influenza A still circulating in our community. So again, the healthcare provider, if they think the person's at risk, can coordinate testing. But at the current time, many people want tests that don't meet the criteria for testing.
Could you talk about the efforts that you all are undergoing now? I know yesterday you were meeting with the mayor and the executives of the hospital systems here. What's being done now to talk about, setting up places at hospitals where maybe folks are not going into the main hospital? Are all the hospitals going to have exterior areas, our ICU bed capacity? What are the discussions there you all are having with the hospitals right now?
Sure, and I'll point out Dr. Randolph, who is in the back. So Dr. Randolph has actually been leading the conversations with our healthcare partners for many, many weeks now. It's not a new conversation. And we're looking at multiple things. One is capacity, or is there bed capacity, or is there sufficient PPE? But also, how is there standardized workflow from one healthcare facility to another to reduce exposure of staff? And then if there is a need, like a tent, we do have one resource here in Shelby County. How do we deploy that resource? And then also, how do we get to expedited testing? I'm going to take one last question.
In places like Little Rock, they have drive-through testing. They're setting up in emergency parking lots and things like that. Is there any conversation taking place in Shelby County to have those sort of drive-through testing facilities here?
So I used the term earlier, expedited testing in partnership with UT and some others. And the reason that I use that terminology, in some places that are doing drive-through testing, they've actually ran into a lot of challenges. It's not always easy to collect a specimen through the car. And so we're looking at what are all the best ways to get people in and out quickly, and how can that be done. And drive-through is one possibility, but it's not the only one. And so yes, those conversations are happening, and the goal would be to do some testing this week. And I'll give you the last one, then we'll wrap up.
Thank you. Since all three cases in Shelby County that we know of were people who contracted it out of state, we believe, does that have any bearing on advice for Shelby Countyans and travel plans?
So we've been saying for some time that people really should forego non-essential travel, and not just to parts of Europe, and also cruises, but also in parts of the United States, and limiting that unnecessary travel, and if they have to travel for some necessity, to limit contact in the general population, so that we reduce the likelihood of people bringing it back to our community. So I want to thank you. We'll do this again tomorrow at 2. I know many of you reach out to Joan during the day to have questions answered. So if there are questions that we can put off till the next morning or till 2, we're actually we'll address them in either the morning report or the 2 o'clock. So don't be surprised. We want to make sure we're getting everybody the right information in the right time. Thank you.